Hello everyone, and welcome. In today's Milady Barbering 6th Ed 2018 Chapter 4 Infection Control Review Questions Practice Session, we'll go through 14 updated questions designed to help you prepare for the exam. When each question appears, pause the video first. Choose the answer you believe is correct, then comment your answer below before resuming the video to see the correct answer. Keep track of your score as you move through the questions, and let's get started. Flashcard 1. What is the primary purpose of regulatory agencies? Pause and think of the answer before the reveal. The answer is, require the infection control measures and safe work practices be applied while serving the public. Flashcard 2. What is an SDS? Where can they be obtained? Pause and think of the answer before the reveal. The answer is, safety data sheet provided by manufacturers. Flashcard 3. List the 4 types of microorganisms that are pertinent to a barber. Pause and think of the answer before the reveal. The answer is bacteria, viruses, fungi, parasites. Flashcard 4. What is a contagious disease? Pause and think of the answer before the reveal. The answer is a disease that can be transmitted. Flashcard 5. Is it a risk in the barber shop? Why or why not? Pause and think of the answer before the reveal. The answer is yes, in shaving or cutting if the skin is broken. It is a blood-borne disease. Flashcard 6. What is the difference between cleansing, disinfecting, and sterilizing? Pause and think of the answer before the reveal. The answer is sterilizing destroys all microbial life including spores. Disinfecting eliminates most microorganisms on non-porous surfaces. Cleaning is removing of dust and debris with soap and water. Flashcard 7. What is complete immersion? Pause and think of the answer before the reveal. The answer is when there is nothing out of your solution. Flashcard 8. List at least 9 safety tips to follow when using disinfectants. Pause and think of the answer before the reveal. The answer is keep the SDS on hand, wear gloves and glasses, avoid skin and eye contact, add disinfectant to water when diluting rather than adding the water to the disinfectant to prevent foaming, which can cause an incorrect mixing ratio. Use tongs, gloves, or a draining basket to remove implements from disinfectant. Keep disinfectant out of reach of children. Carefully measure and use disinfectant products according to label. Follow the manufacturer's instructions to mix, use, and dispose of disinfectants. Carefully follow manufacturer's instructions when replacing solution, and replace every day or more often if it becomes soiled or contaminated. Flashcard 9. What are the characteristics of items that can be disinfected? Pause and think of the answer before the reveal. The answer is clean, hard, and non-porous surfaces. Flashcard 10. What does porous mean? Name 2 porous items that can be cleaned and disinfected in between use on clients. Pause and think of the answer before the reveal. The answer is porous surfaces allow water, air, or particles to pass through. Flashcard 11. What are standard precautions? Pause and think of the answer before the reveal. The answer is wearing of non-porous articles such as gloves, goggles, and face shields. Flashcard 12. What is an exposure incident? Pause and think of the answer before the reveal. The answer is contact with blood or body fluid. Flashcard 13. Describe the procedure for handling an exposure incident on a client in the barber shop. Pause and think of the answer before the reveal. The answer is stop the service immediately, dispose of blade in a sharps container and place razor in container. Apologize for the incident, wash your hands and put on gloves. Apply pressure to the area to stop bleeding. Dispose of used cotton round in plastic storage bag. Clean with an antiseptic and have client wash the area if appropriate. Dispose of antiseptic wipe in plastic and dispense septic powder onto cotton round and use a swab to stop residual bleeding. Apply adhesive bandage to completely cover wound. Clean and disinfect the workstation as necessary. Discard all single-use contamination objects in a plastic bag and throw away. Deposit sharp disposables in sharps box and dispose as required by law. Flashcard 14. List the 4 things that must be on a disinfectant label for approved use in all states. Pause and think of the answer before the reveal. The answer is product's name, Ingredients. Keep out of reach of children's statement. Sigma words. First A instructions.